Have you ever really stopped to think about what's actually going on when you take something for an upset stomach? Well, today we're going to do just that. We're opening up the medicine cabinet and diving deep into your guts toolkit. We'll explore the super fascinating science behind how these everyday medications work to bring that delicate balance back to your digestive system.
Oh, come on. We've all been there, right? One day, everything's running like clockwork. The next, your digestive system seems to have just completely gone rogue. It can feel totally random. But trust me, underneath it all, there's some really cool science explaining what's really going on.
And you know what? It almost always boils down to a super delicate balance between two key things. Motility, that's just a fancy word for how fast things are moving, and fluid. When that balance is just right, everything's great. But the second it gets thrown off, well, that's when you really start to feel it.
Okay, first up, let's talk about what happens when things slow down to a crawl. The best way to think about constipation is as a massive traffic jam right in your gut. So the big question is, how do we clear the road and get things moving again?
A lot of the time, one of the main problems is surprisingly simple. There's just not enough volume. See, your intestinal muscles, they need something to grab onto to create that wave-like motion that pushes everything along. If there isn't enough there, things just stall out. So, the simplest solution? You gotta add more bulk.
And that's exactly where bulk-forming agents like methylcellulose come into play. These are basically fibers that your body can't digest, so they just hang out, acting like a sponge, soaking up water and creating a much larger, softer mass. And that sends a signal to your gut saying, hey, it's time to get moving. And here's a super simple way to remember it. The drug name itself gives you a huge clue. If you see cellulose in the name, just think bulk. See? Easy. Okay, but what if the problem isn't a lack of volume, but instead it's a lack of water? That leads to hard, dehydrated stool that's just really difficult to pass. The fix here is to rehydrate it. And the way we do that is by basically turning your gut into a powerful water magnet.
So here's how this works. It's pretty clever. Osmotic agents like PEG and lactulose are made of these molecules that your body just can't absorb. So because they're stuck in the intestine, they start drawing water from the surrounding tissues right into the gut, almost like, well, a magnet. All this extra water softens everything up and makes it way easier to pass.
And yup, we've got another easy way to remember this one. PEG and lactulose load H2O. Just think of the L in lactulose as loading up your gut with water. It really works.
But sometimes the problem is just a lazy system. The intestinal muscles simply aren't getting the signal to contract. When that happens, we kind of have to bypass the usual chain of command and give those nerves a direct wake-up call. And that's the job of stimulant laxatives. Drugs like Senna and Bisacodyl directly poke the nerves in the lining of your gut, which, by the way, are part of this incredible system sometimes called the second brain. This tells the muscles, hey, contract now, and gets the whole system moving. It's a very direct way to wake up a sluggish gut.
The memory hack here is pretty much a gimme. The names themselves, Senna and Bisa, tell you exactly what they do. They stimulate a wake-up call for your digestive tract.
And believe me, the toolkit gets even more specialized from here. For instance, some medications work by opening up these tiny, specific channels in the intestinal wall to let more fluid seep in. Others can even target and block the constipating side effects of other drugs, like opioids, but only in the gut, so they don't affect pain relief. It's all incredibly precise.
All right, let's completely shift gears. We've gone from a traffic jam to the total opposite, a flash flood. This is what happens when things are moving way, way too fast. So with diarrhea, your gut is just in complete overdrive. Everything's moving so fast that your body doesn't have enough time to absorb water and nutrients like it's supposed to. The goal here is pretty obvious, right? We need to find the brake pedal and slow the whole system down.
So how do we slam on the brakes? The mechanism is actually fascinating. The most common anti-diarrhea medication, loperamide, works by targeting the very same receptors in the gut that are affected by opioids. Now don't worry, it doesn't have the same effect on your brain. But in the gut, it slows down those muscle contractions, giving your body the extra time it needs to absorb water.
And to lock that one in, just think lope at a slow, midinant pace. Loperamide helps things move at a much more civilized pace. Okay, now we're going to move to a condition that isn't just a traffic jam or a flash flood. It can actually be both, and it often comes with a whole lot of pain and discomfort. Let's talk about the very unpredictable system of irritable bowel syndrome, or IBS.
So first off, what even is it? Medically speaking, IBS is called a functional disorder.
That means if you were to look at the gut, the structure looks perfectly normal, but it's just not functioning correctly. The hallmark is abdominal pain that's linked to changes in your stool.
You know, managing IBS is really all about using the right tool for the job, from that toolkit we've already been exploring. There's no one-size-fits-all cure, so treatment has to be tailored to the person. If constipation is the main issue, that's IBS-C. The goal is to increase fluid. If diarrhea is the dominant symptom, IBS-D, the whole focus is on slowing motility. It's all about trying to bring that system back into balance.
And beyond that, there are other treatments that address the broader symptoms of IBS. This can include things like special diets to reduce gas, meds called antispasmodics to help relax the gut muscles, and even, believe it or not, low doses of certain antidepressants. It turns out these can actually help manage the pain by changing how the brain perceives pain signals coming from the gut.
So as we've seen, managing gut health is about way more than just one simple fix. It's about having a full toolkit of really sophisticated strategies that we can use to tackle a whole range of issues, from the really simple to the incredibly complex.
So let's recap the core strategies in our guts toolkit. 1. We can add bulk to give the system something to work with. 2. We can add water to soften the path. 3. We can stimulate the nerves to wake up a sluggish system. 4. We can slow everything down to calm an overactive one. And 5. For complex conditions like IBS, we mix and match these tools to restore that all-important balance.
When you really think about it, almost everything comes down to managing two key things: movement and fluid. But the sheer ingenuity of the ways we figured out how to do that is just incredible. So the next time you reach for one of these remedies, maybe just take a second to appreciate the amazing complexity of your own body and the delicate balance it's always fighting to maintain. It makes you wonder, what other systems in our bodies are we just beginning to understand?